Hello, my name is Anne-Marie Kessler, and I'm glad to have the opportunity to present to you what I've been working on for the last couple of weeks regarding onchocerciasis control in serene Leone. Onchocerciasis, or river blindness, is a parasitic worm transmitted from person to person by black flies. These worms are the second leading cause of preventable blindness in the world. And these flies can bite up to 10,000 times a day, and they're found in fast flowing streams and rivers in tropical areas. Areas such as the 31 sub Saharan countries in Africa, Yemen, and Latin America. These parasitic worms can live up to 14 years in the body of an infected individual. The female worms can then grow up to 33 to 55 centimeters and reproduce thousands of offspring for up to 9 years. These offspring are known as microfilaria, and they travel throughout the body, causing damage to muscles, organs, and most importantly, the eyes. In 2017, an estimated 1.15 million people were experiencing vision loss, and 14.6 million were experiencing skin disease associated with onchocerciasis. In Serene Leone, an estimated 2.6 million people were infected in 2003. That makes up half of the population at the time, and it was so common that communities believed that it was just normal for people at the age of 30 to go blind. The importance of acting and providing treatment for this global health issue is the easy transmission of the disease from countries and communities. It takes one infected black fly to potentially infect 10,000 people in a day, leaving 169 million people at risk in sub-Saharan Africa alone. The infection will lead to social isolation due to unsightly skin conditions that occur and the chances of becoming blind. This fear has led to many villages and communities to move away from the river valleys and decreasing their economic benefit because of the fertile land they're leaving behind. The prevalence of onchocerciasis globally affects 40 million people worldwide. All of these countries rely on agriculture for a living, so they're harvesting coffee, cocoa, and rice. These third world countries are often unstable and they lack the funding for medical resources. As of 2017, the number of infected individuals has decreased to 20.9 million worldwide due to the efforts made. However, regionally, 99% of those people infected are found in sub-Saharan Africa, leaving about 20.6 million people infected in Africa alone. Locally, Serene Leone, as of 2013, again, only half of their population has been infected, leaving the other half at extreme risk for infection. Mortality, morbidity, and disability-adjusted life years. Mortality for onchocerciasis is non-existent. Does increase the morbidity rate due to the life of living with extreme pain and very debilitating symptoms. This is also associated with a mental health decline from the isolation, disfigurement, and the loss of sight. There is also the social status change due to the stigma placed on the infected individual. There's also the strain on the family and community to provide care for these individuals. Lastly, the disability adjusted life years, known as DALY, in 2015 was estimated to be 1.1 million years lost to infected individuals. Determinants of health. Physically, onchocerciasis has a significant effect on an individual's mental and physical health. With debilitating itching, skin lesions, and skin nodules, and visual disturbances, the morbidity of the disease is very high. Socially, the individuals suffer with the stigma of the unsightly lizard-like skin and the depigmentation. The lack of education increases the social stigma because of the belief that it's caused by witchcraft. And with the visual disturbances, family members are obligated to provide care and help guide these individuals. Environmentally, Savannah, Africa sees more of the eye lesions, blindness, increased microfilaria count, and the presentation of skin lesions rather than nodules. But the African forestland sees fewer eye lesions, more moderate microfilaria count, but they have more skin nodules, more gross skin lesions, and gland lesions. Behaviorally, individuals in Serene Leone do not have the best hygiene, nor do they have the ability to improve it. Serene Leone lacks the access to clean water and proper sanitation, therefore increasing the black fly population prevalence in the areas. Infected individuals are unable to be productive at work due to the intense itching, so they get paid less and or become unemployed because of their productivity. And with constant symptoms, they seek care from the healthcare, but with Serene Leone's lack of doctors due to the 2014 Ebola outbreak, bribes are expected just for basic care. Other conditions in a relationship, there has been many cases where individuals develop epilepsy or nodding syndrome due to intense infection. This is caused by the microfilaria either entering the central nervous system or an immune response due to the worms being infected with bacteria, viruses, or other parasites. This also could be due to extreme sleep deprivation from itching so intensely. And malnutrition can also predispose individuals to these tropical diseases, and these diseases then increase the malnutrition. Co-endemic to Serene Leone and onchocerciasis is lymphatic filariasis, also known as elephantitis. This is the extreme swelling of the legs, arms, and genitalia, and this is passed on by mosquitoes. Another co-endemic disease is schistosomiasis, which is passed along by freshwater snails, and they enter the body and cause havoc to the liver, kidney, and spleen. Organizations working on this illness include World Bank. The World Bank kind of spearheaded the whole process, and they're in charge of the financial aspect of these programs, and they get the money from the donors and sponsors and distribute it even where it needs to go. The World Health Organization kind of organized and implemented these control programs like APOC and OCP, and the Food and Agriculture Organization helped with the harmless larvicide spray that they used, and then helped build up these farms and agriculture areas. The Non-Governmental Development Organization, or non-governmental organization, worked with local governments to claim the importance and how prevalent it is to have these community distributed organizations and programs in APOC enter their country and provide care. MDA, Mass Drug Administration, was the key to the success of these programs. They distributed the drugs to the community-directed programs with the help of APOC and with the help of Merck that provided and donated these drugs to distribute. Serene Leone has a national neglected tropical disease program, and they provide care for the 12 districts that are infected in Serene Leone, but they're not only treating onchocerciasis, they're also treating diseases like lymphatic filariasis. And primary prevention for onchocerciasis was education in Serene Leone. They used radio stations and programs to talk to experts, victims, and local leaders, and they're answering questions and concerns about onchocerciasis and fighting these misconceptions and advocating for the treatment and why it's so important. OCP, Onchocerciasis Control Program, used aerial spraying via helicopters and ground crew in the 11 sub-Saharan countries. Serene Leone was added, but due to civil war and civil unrest, they didn't get constant care until 2003. And this program prevented 600,000 new cases of blindness, and it brought back 25 million hectares of land, introducing 100 new villages and 8,000 new farms. And Serene Leone's National Neglected Tropical Disease Program continued to provide care, and along with their technical advisory committee. Secondary prevention included APOC, the African Program for Onchocerciasis Control. They took over Serene Leone's care due to their lack of success with OCP, and with the help of the pre-MDA registration and the census in the country, they were able to provide coverage for 70.1% of the country. And with their high therapeutic and geographic coverage, they achieved this by increasing human resources and strengthening the Serene Leone health systems. And ivermectin was the chemotherapy drug that was found to be effective, is given biannually for a minimum of 14 years with dosages based on weight of each individual. Continuing with the secondary prevention, in 2014, Sierra Leone kind of revamped their national neglected tropical disease program to introduce cross-border monitoring, such as the Mana River Union, looking at the Liberia, Guinea, and Ivory Coast to monitor those waters between them. They also started the epidemiology surveys and funding data collection to monitor these cases. And clean water and proper sanitation are still a big fight and long process that they're in the middle of. An overview, OCP eliminated transmission to 10 of the 11 countries they provided care for. And APOC took over care with the chemotherapy drug, again, preventing 600,000 cases of blindness and 73% reduction in onchocerciasis. And with the help of FAO, agriculture increased the economic and nutritional health of these countries, and this improved livelihoods because of the treatment of their skin disease and blindness as a whole. And to show the effectiveness of the drug, in Sierra Leone, microfilaria prevalence was reduced by 50% with just 5 treatments. In conclusion, the most effective evidence-based treatment is the chemotherapy drug ivermectin, or Mectizan as it was later renamed. This drug is, again, chemotherapy, and it treats the morbidity and reduces the transmission of onchocerciasis. And this drug is a very cost-effective method, costing only 30 to 50 cents a person. And this could not be possible without the generosity of Merck donating as much and as many pills as we need. With it being so cost-effective and successful, there's no changes to the programs needed at this time. As for Sierra Leone, in 2017, they are estimated to eliminate onchocerciasis by 2022, with only 2% of the population still being infected and no new cases of blindness. Barriers seen. Socioculturally, barriers were faced because of the mistrust for healthcare and doctors in Sierra Leone. These individuals also don't trust the drug being free. They don't believe it's very effective and that it's low quality due to its free nature. To overcome this, continuing to educate and using that community-directed distribution to educate these individuals about the effectiveness is key. Geographically, there was a lack of roads and or low quality roads, and it was hard to access these villages. So maybe using donations to repair these roads with inexpensive mediums like gravel or dirt to have increased access. Lack of volunteers was a big one for community-directed distribution. Many of these individuals believe they need to receive a monetary return for their time and efforts given for this program, but with the number of programs and community directed distribution, there's too many to provide a substantial salary. So maybe talking to government or village representatives to find individuals who will provide this free volunteer, or finding a way to pay these individuals. Again, clean water and sanitation are a big barrier, and 57% of Sierra Leone has access to clean water, but the rest do not. And only 40% have improved sanitation. So continuing to work with the government and organizations to provide clean water and sanitation to Sierra Leone is the best way to really prevent any reinfection. And overall, for all of these barriers, reinforcing community involvement is key. So improving the pride and ownership that they feel for their community will help improve the uptake and success of the treatments. And with NGOs' continued help, Sierra Leone can continue to perform above the rest and beat onchocerciasis and other neglected tropical diseases. As for that, I want to thank you for your time and consideration, and I will now answer any questions that there may be. If there's none at this time, feel free to contact me with any questions that arise with the contact information below. Great, thank you.